My name is Blythe O'Hara, and I'm so pleased to be here today on a day that marks 20 years of PRC. I've been involved in the prevention research collaboration for just over 10 of those years as a policy colleague, a student, executive officer, lecturer, and now as a senior research fellow. The focus of my presentation today is on measuring impact, specifically on measuring the impact or maybe the influence that PRC has had over its lifetime. And I'm going to share with you the beginnings of a project we're working on that hopes to provide some insight into the so what of PRC. PRC has a long history of doing applied research that has been relevant for policy and program makers. It started 20 years ago with the Centre for Physical Activity and Health, the Centre for Public Health Nutrition, the Centre for Overweight and Obesity, and more recently with funding under PANORG and the Prevention Research Support Program. Adrian will be providing a more detailed trip down memory lane in session 3 this afternoon. But whatever iteration or centre we have been, our work has always focused on assisting and supporting the development and implementation of evidence-informed programs, policies, strategies, services and campaigns in the health sector. This is well described under the purpose of PRC, that we undertake collaborative research projects involving researchers and policymakers to create the knowledge and evidence needed to improve policy and practice in the prevention and control of non-communicable diseases. When we look at the last 10 years of work, so 2013 to 2023, and focusing on the work undertaken by PANORG under the Prevention Research Support Program and some of our other more general PRC projects, we can see what proportion of these projects have occurred across the stages of research and evaluation in public health. Of the nearly 200 projects or so, 19% have occurred within the area of problem definition. For example, the Lancet series on physical activity, trends in e-cigarettes use, and the school's physical activity and nutrition survey. 26% have occurred within the area of solution generation, for example, doing a number of rapid reviews around things like sugar and health, school canteens, and things like a guide on workplace health promotion. 33% have occurred within program evaluation, and along with 9% of the projects which are involved in the evaluation pre-planning phases of the project, so things like logic models and evaluation frameworks, that incorporates a significant number of projects and examples, and they include things like the New South Wales Get Healthy Service evaluation, the Make Healthy Normal campaign evaluation, and the evaluation of the New South Wales Quit line. So we've seen less activity has occurred around methodology development, and similarly Scale-Up has been a more recent innovative addition to the work we do, and we will likely see more additions in this area, and particularly around implementation science in the years to come. You'll hear some more examples of the work that we've been doing in the presentations that follow mine. In addition to the number of projects that we've done, we also spend a lot of time building the capacity of the public health sector, and that might be things like taking on advisory roles at state, national, international level, developing micro-learning modules, supporting placements, such as the public health officer trainee and biostats trainee positions. We do a number of seminars and symposia, and we also facilitate policy dialogues and the like. But the question we are wanting to answer is, what impact have we had? What can we say our influence has been? And we're not the only ones grappling with defining impact, determining how we can measure and capture it, working out under what circumstances or conditions it's optimised. The literature in this space has been steadily growing, and based on this literature, we are seeking to articulate what the causal relationship between our work and its impact has been, and where we define research impact as being a demonstrable or a perceptible benefit to the individuals, groups, organisations and society that are causally linked to that research. We are also looking at what evidence is available that supports that our work was necessary to achieve an impact. And by necessary, it is seen as a significant contributor and maybe one of many to an impact, and that is rather than being the sole or the sufficient contributor. We're also interested in generative causation, which is the way of showing the mechanism or the process that causes the research to generate impact. So we have a dual focus, not only on determining what impact was caused, but the conditions or the mechanisms that were present to generate that impact. Borrowing from a number of authors and academics, the domains of impact that we are interested in exploring are the range of intermediary impacts that occur on the pathway to that ultimate health and well-being benefits. And they cover topics like producing and advancing knowledge, the use of research in the research system, the use of research in informing decision making by our policymakers, and then the impact that this has on the health system and maybe even health. The literature does provide us with a number of potential measures and metrics that can be used to capture impact. So for things like knowledge production and advancement, it includes outputs such as publications and reports. For research in the research system, it includes impact, such as citations, journal impacts, etc. For research in informing decision making, it includes knowledge exchange opportunities, tailored information packages and presentations, and policy dialogues, etc. And for the health system impact, authors talk about measuring changes in policy and practice and capturing involvement of the research in decision making. And whilst we are wanting to understand these impacts, as I mentioned before, we're also particularly interested in the mechanism and the conditions by which our influence and impact has occurred. This will be particularly important as we move forward ambitiously into the next 20 years so that we can enhance the way we work and how effectively we translate research into practice. As I said, this project is in its early stages, but we have determined the next steps, and again, they're informed by the literature. We're going to be looking at developing a logic model that maps the pathway to impact and establish domains of benefit. We'll also look at some case studies that we can particularly focus on. We'll look at identifying process and impact indicators and relevant data sources, and we'll look at how we can collect data around those data sources. And obviously we'll move to ethics applications and implementation. But I would like to invite you to think about how the work we have done, possibly in partnership with you, has influenced your own work and what has made this more or less a success. Over the next 7 presentations, you'll hear more about the work that PRC has been involved in. And then in session 3, there will be a moderated Q&A panel. So if there are any questions you would like to pose to the panel about what you've heard this morning and provide your thoughts on how we can capture and maximise impact, we would really welcome your involvement now and in this project as it moves forward. And lastly, a quick note of acknowledgement to the many partners who have collaborated with us since we started, and a particularly heartfelt thanks to the Ministry of Health, who have been one of our primary benefactors over the last 20 years.